For today, we have with us Nick Kempe. Nick Kempe has a lot of experience in care and commissioning of services. He was involved in social care in Glasgow and is currently involved with the Common Will. That is a group of people that are really looking into social care. And I have to say, I read everything that they kind of published regarding the social care, because when all this kind of the National Care Service came about and the bill, it was good to hear from someone and people that actually knew what this kind of decision maker we're talking about, and to put everything in perspective. So it's my pleasure to introduce and to give the floor to Nick. So welcome, Nick. You have to unmute yourself, though. Thank you.
Hello, everybody. Thanks very much for inviting me, and apologies first, because actually, because my mother suddenly lost her twin sister who dropped down dead suddenly, I had to disappear. This meeting was previously scheduled, and I had to go down south to do some family support around that. So anyway, I'm very pleased to be here today. And as Carmen says, what happened as a result of I used to be a social work manager. I'd stopped, got out, retired. And then when I saw what was happening in the COVID crisis, I was pretty appalled, particularly on care homes, which I used to do a lot of work about. So from that, I got involved in Common Will. We've got a care reform group. And we've been meeting almost weekly for 2.5 years now, and we just talk about care the whole time, and I've learned so much. So what I want to try and do is some 3 fantastic contributions, and I'm going to take a bit of a wider issue, and I hope I might put that into some context for you so you can understand. So I'm afraid it's going to start at quite a high level, but then I'll try and zoom down so maybe we can end up looking at what's going on in Edinburgh. So that's what I'm going to try and do. I think the first thing is nobody talks about what is care, or at least the Scottish government doesn't, right? They produced a National Care Service bill that's been thankfully halted. It never defined what care was, nor did the Feely review before that. In fact, we've never defined care, right? So I think it's very important to just think about what it is. And really, caring is all about feeling concern or interest in other people. It's about our relationships with other people, and part of caring is about helping or protecting other people. And that happens at all sorts of different levels in life, right? So it's embedded in everyday life. When we go into a shop and, have a chat to the person in the corner shop or whatever, that is about caring for people, right? All the way up to what we've heard today, people who are dedicating their lives to look after somebody, right? And so care is very, very diverse, but it's what makes us feel parts of society. It's all about relationships, and it's not one way. So actually, even if we're caring for children, we all depend on care to grow up, but actually a parent caring for their child depends on getting some reaction from the baby, right, to them, the first smile or whatever. Caring starts being reciprocal from the start. And as was said earlier, if you're a carer and you're looking after someone who's very dependent and can't give you that sort of positive feedback and so on, that is extraordinarily difficult and demanding, right? And actually, it's not just informal carers, and care staff are often working with people who can't actually give that much back. And that's really, really difficult. Right. And I've said that care needs arise from being human. They're both mental and physical, and they're central to our development. We wouldn't grow up, we couldn't develop without them, right? It's not always very good care, but it's always, for us to reach adulthood, we couldn't get there, right, without some measures of care. But how care needs are met also has a major impact on health needs. And this is something the government doesn't seem to realize. They talk about a mental health crisis, and their reaction is we need more psychiatrists. Actually, most of the time, we just need more caring, right? And the government completely hasn't got that. right? And then there's some other factors, right? So some people have additional care needs, for example, as a result of disabilities, social disadvantage. Everyone's talked about poverty. Poverty has an absolutely crucial role in the level of care needs that people have. The other thing I'm going to say is that care is, and I would say it is irredeemably complex. You cannot simplify it, right? So we all have conflicting feelings about care. You know, we sometimes hate the people we love most, right? That's what care is about. It's about frustration. It's about a lot of complicated things, right? And I just want to then say that, so our argument is that care is central to life. Creating a caring society is what we needs to be about. And so it's much, much wider than care provision, as other people have said. But we also, care goes wrong, right? And that can be the very small things. We all have our off days. We snap at colleagues at work or at family or other people. We just don't feel like getting out of bed, right? Well, I've already mentioned, right? Giving without receiving is really challenging and stressful. Every parent knows what it's like when their child has been screaming for a couple of hours. You think you're going off your head, right? And we have no support for that, right? Many social problems have their origins in a lack of care or care going wrong. So we've got drug addiction, suicide, homelessness, loneliness, and so on. And there are some people too, I suppose they get labeled psychopaths, who actually grow up not to care, right? Or there are particular situations like war where people stop caring about other people and do the most dreadful things, right? So we're in a position, and I think this is quite important, we see this with the radical right around the world, that in extremis, right, the caring relationships that hold society together can just collapse. You know, we sort of end up with an America where people say the answer to everything is you have your gun, right? And that is like completely the opposite of a caring society, right? So I know that's very general. I want to say that I think it's important because that is behind the case for care provision and for social work, right? And really what we need is care services be about meeting care needs which would otherwise be unmet, right? So if a parent is struggling with a child, a care service should give some support with that, right? All the way down to the highest level of dependency, or people, older people, all their friends, their family, people die, they're left alone. Care services should be about meeting those needs that are unmet. What social work's role should be about helping people whose care needs are unmet or who are facing difficulties with caring relationships, right? So my response to Linda and our model is you should just be able to go and see a social worker around the corner like you see a GP, right? And the social worker should just be there to help. That's what we need, a very, very basic model, right? But it's what we're looking for. And that support for informal carers is it should be an integral part of service provision, right? Because we all know, right, there's 10 times the amount of informal care as paid care in Scotland. There's all this talk about supporting carers. It's non-existent. And the care bill wasn't going to make any difference. The so-called right to respite was, in my view, totally pathetic, right? But the last thing about this is we need, what I would say is we also need a sort of wider public care function. So it's a bit like we have public health at the moment that tries to promote health across society. We also need to be thinking about how do we make a more caring society, right? Everywhere, you know, how can we care for people better at work so they don't go off on stress? All these things basically about how we care for people. Right, so I hope that's not taking us too far off, but I just want to I'll come back to the crisis in the moment, right? But I'd just like to give a little history here because I think it's quite important to understand this for what's going wrong, right? When the Prime Minister who set up the health service, Clement Attlee, not a lot of people know he was a social worker, right? He was a social worker who actually failed dreadfully because he set up the welfare state but he basically left social work and care out of it. Right? So what happened in the 1940s Labour government is that they created, right, a whole lot. They created the health service, people will know that, national insurance to help people to deal with lots of schemes to deal with poverty, the Children's Acts, Housing Acts, legal aid, so you could get help with your rights if you didn't get services. All that sort of thing was part of the welfare state. But what was left aside? Care. And actually, so care was left to basically, and what happened was that the NHS was founded on need. So, and there's a nice quote from Nye Bevan introducing the Care Bill in 1946. It has been the firm conclusion of all parties that money ought not to be permitted to stand in the way of obtaining an efficient health service, right? And it's still in the NHS constitution, believe it or not, that access to health services is based on clinical need. So if a doctor says you can have it, right, and that's basically why the health service has been so successful, there is still, and I know there's a whole lot of providers about it, but it's still basically the position, and it's driven improvements in healthcare provision. And along with that, there has been professional autonomy for doctors, so that doctors can, they have discretion. They're not managed like social workers. They're not subject to the same bureaucracy. And that has some bad things maybe, but it also has quite a lot of good things, because decisions tend to be made on judgment, right? And they often get the judgment wrong, but at least the person you see is the person who takes the decision, not somebody further up the hierarchy, right? But what happened for care and things is, well, and this is what Nye Bevan said, there were residual groups. They called them then the handicapped. That was the old and disabled, right? Basically, the priority was the abolition of the workhouse, right? And they passed responsibility for welfare for those people to local authorities, but without any funding, right? Without any additional funding. Completely unlike the NHS, right? So what we had was basically resources were determining needs, right? And Bevan said that the extent to which we can carry out work to do with needs will depend on our resources, right? We haven't dealt with that issue in 70 years, and it's bedeviling the current system. Right? And it's also worth saying on that there that social workers have never had any professional, I mean, regarded as a semi-profession, right? And they're very much under managerial control. So we have two systems. And actually, there's a very nice map in the committee papers to the last EIJ, the Edinburgh Joint Board, and it showed all the GP surgeries in southeast Edinburgh. I make up that there are 13 GP surgeries. So you can probably, most people have a GP around the corner that they can go and see. I know there's all sorts of problems, but they have that, right? There are 3 social work, well, there's 1 social work office in each locality, as I understand it, dealing with the whole locality. Completely different, completely inaccessible compared to health, right? So just moving on from the history, so while there was a very bad start for care, in 1968, there was a Social Work Scotland Act was created, and it did something quite revolutionary, right? It made it the duty of local authorities to promote social welfare. So that was a new duty. And it also created a duty to assess need. So local authorities have a duty. Everyone who's talked about care needs here, they have a duty to assess that. That's never been repealed. The problem is there's no money to do it, right? And also in the 70s, the same time there was the Chronically Sick and Disabled Persons Act, and that introduced a whole lot of other duties, right? For example, to make public buildings accessible. That's a process still going on 50 years later, right? But it also, at the time, created a duty on councils to provide a whole range of services, educational, recreational, and so on, as well as personal care. Most of that is completely collapsed. It's just disappeared. Anyway, what then happened So there was a bit of hope at the end of the 60s, early 70s. But of course, then basically there was economic crisis during the 70s, at the end of which Margaret Thatcher came into power. And what she decided to do was basically that the private sector was the answer to everything. So she basically decided to create a care market, right? A private care market. She did so. Markets hardly ever develop out of nothing. They develop with state funding. So there was enormous public sector funding for private sector care homes in the 1980s. And then the NHS and Community Care Acts created a whole framework for outsourcing services, right? And included in that was basically what then happened was social workers turned into, from assessing need, they were turned into gatekeepers for resources, because what was happening is, while the local authorities were funding the private sector, they decided there wasn't enough money, so limits had to be put on that, right? So that marketing of the outsourcing of care had an absolutely massive effect. And you can actually see that in the Edinburgh Joint Board, right? If you look, there's the annual report, and I got some slides which I send round later. But if you look at how the expenditure in Edinburgh happens, right, is actually by far the majority of Edinburgh City Council funding goes to private services. This has already been mentioned, right? It's just huge. Whereas the NHS, right, it's got huge levels of in-house services. There's a very nice graphic that just shows that for the IJB and just how distorted our care system now is, right? Now, got these two streams going on, if you like. It's health and care, very different. Then what happened is that, partly due to the success of the welfare state, coupled with other societal changes, right, the demand for care provision started to go up. And basically, because of things like medical advances and so on, there were people with disabilities who might have previously died, survived. There were people who previously were dying very young through poverty, so they never ever reached retirement age, right, were living much longer. So the success of other bits of the welfare state drove up the need for care. And what happened is there was increasing awareness of this, right, ever since the 1990s, and people realized, particularly got worried about there was going to be an explosion in the numbers of older people, right? And they thought, how are we going to cope? We've got insufficient budget. So this whole improvement program started up, this whole idea, and the Blair government was particularly strong about it, right? We've got to improve public services. And what wasn't really being said is they're going to have to do ever more with less, right? And that basically, that thinking, right, has just led us into complete and utter disaster. And people have mentioned the resources, and it all unraveled during the COVID crisis, right? But it's been made worse by some other things because of that increase in numbers of older people. And I think it's worth, there are very big links with the NHS here. We've got more and more of what I would call just-in-time healthcare. So instead of the NHS doing some care as well as medicine, right? They used to care for people while they recuperated. The whole model was you get someone into hospital, you do something to them, and you get them out as quickly as possible. And that model, and it hasn't worked in any area of the economy, as we've seen with Brexit and so on. It hasn't worked in healthcare, but it has dominated political thinking for a long, long time. So for 20 years, the Scottish Parliament's main focus has been on delayed discharge from hospital. It's how to speed up turnover in hospitals so they don't have to spend more on health too, right? And from that, basically, the whole agenda of integration of health and care has come from that. It's the politicians have seen that if we could sort out our care systems, right, we could sort out the problems in the NHS. And all it's done is everything I said about the wider aspects of care, right? The whole care system has just been subjugated to serving the needs of the NHS. And that just isn't care. Right? And it also hasn't worked because they've got rid of all those wider things to do with care, right? There's increasing mental health crisis, all of these other things. And so people end up in hospital anyway, right? So there is a major issue there. I'd just like to touch on a couple of other things before I focus in on Edinburgh, right? One of the other thing that has afflicted social care is what rebellious social workers will call managerialism, right? And basically, budget management replaces welfare, right? It's really accountants versus social workers. You'd be amazed how many heads of various bits of IJBs and so on come from a financial background now. They don't come from a care perspective at all. It's all about risk, not need. So they look at how do we protect people, but not on actually what people actually need on a day-to-day basis. So if you're managing, although you're struggling, you're not a risk, you're ignored, right? There's a lot of proceduralization and centralization going on. So the amount of time that people have to follow on procedures is absolutely extraordinary. We said earlier that caring is all about relationships. That means that people don't actually have time to provide the sort of caring support for people. That's whether you're a care worker or a social worker. You don't have a chance. And that has been partly driven through regulation. We have two regulators in social care, the Scottish Social Services Council and the Care Inspectorate, and it's turned things ever more bureaucratic, right? Lastly, the thing about managerialism, and this is part of wider government that's going on, is that the central government has turned to the private sector for solutions. So we have this crazy situation that the National Care Service was being secretly designed by KPMG, right? And in my view, all these panels of people with lived experience, so-called, that are advising the government is complete charade, right? What's going on behind the scenes was the operating system and so on for the care service was being outsourced, right? To companies' main interest was money, right? So on the eve of the pandemic, and I think Liz was quite right, the crisis preceded the pandemic, but we'd had almost 15 years of real-term budget cuts while demand was growing. We were having financialization of the care sector. So basically big money was moving into care, and as it's trying to get into health, and extraction of large amounts of profit. We'd had the collapse of community-based and preventative services. So all that community infrastructure that's absolutely essential is basically gone. Local authority cuts. We'd got a grossly undertrained and underpaid workforce. That wasn't helped by the EU procurement regulations, which helped drive a race to the bottom in terms of paying conditions. Procurement I used to work in it, has been absolutely awful. We have perverse rationing and resource allocation. So what happens is people get allocated. We've had lots of problems. Everyone will know about the notorious 15-minute home care visit that is no help to anybody, right? Just doesn't help support people. We've got increasingly centralized and unaccountable management through the health and social care partnerships. And policy is dominated by the requirements of the NHS. So I need to be aware of time. I just wanted to thought it might be worth just saying a little bit about the Scottish Parliament here, because really the Scottish Parliament has had lots of good intentions, but the consequences of what it's done, I would argue, have been really bad. So, for example, they introduced free personal and nursing care, and the idea of that was to remove the anomaly that care provided by the NHS was free, but when people suddenly moved to a care home, they were charged. So it was a good idea. But what that happened was the definition of free personal and nursing care meant that actually the only thing that was free was physical care tasks. So everything that's really important about caring for people, right, talking to them, so on, having that cup of tea. In fact, we even know of providers who've told staff, and local authorities who've told providers, if your staff have a cup of tea with a person, that's not care, right? We won't pay you for it. I mean, it's absolute madness. We've got the Adults with Incapacity Act was supposed to help people who got mental incapacity by letting people act for them. We've ended up in a ridiculous situation that those people, if they go into hospital, can't get out again, right? Which is an unintended consequence of that law. We had care standards, which were supposed to make institutions more homely. So they were supposed to make care homes more homely. But actually what they did is, because they had physical space standards, it meant all the good voluntary sector providers were forced to shut down. They've been replaced by large private sector providers with access to capital. I call it care in boxes, basically, is what's provided by the private sector. Regulation, instead of looking at providers and so on, has ended up on disciplining the workforce. So there's something like 1,000 social care staff a year taken through the Scottish Social Services Council disciplinary process. I mean, it's absolutely extraordinary, right? These are people who are untrained and unprepared for the job, and so on. So you can see that I think the record of the Scottish Parliament has really been, and there's been no critical review of what it has done, right? So just to home in on the background, where that's left us in terms of the here and now, right, is financially, right, the Scottish government has not been funding care. The money has gone into health. We know from the EIJB at the moment, Edinburgh Joint Board, that at the moment that they've got an underspend of 5.8 million in the NHS on staff and 5.3 million on council staff vacancies. If they filled their vacancies, they would be totally bust, right? So they've got massive shortfalls. You'd have thought, so they advertise, we've got all these vacancies, that's why they're struggling, but they haven't got the money to fill them, right? So it's absolute disaster. And the IJB estimates they were 25 million short at setup. I mean, you'd have to be a forensic accountant to work it all out, but they are grossly underfunded. There are huge amounts of unmet need. The IJB doesn't record unmet need, right? There's actually been a report I found that there's an estimate from the files that there are 750 people whose needs are being unmet at the moment, requiring 7,500 hours of care. I suspect that's the tip of the iceberg, right? There's a democratic crisis in the IJBs, right? In that the people on the board, the only people really with any independent powers are councillors, right? And actually the union movement has done a fantastic job in Edinburgh on putting pressure on those councillors. And I think they still swither a bit between, are they there as political representatives, right? Or are they actually there? Are they accountable to the Scottish government and just fancy managers? And they don't always know which side they're on. We've got the workforce, mentioned a grossly understaffed, abused and burned out. The first contributor explained that really well. There's very high sickness levels. And we've also got in the IJBs, there's a complete, and what I would describe as neoliberal values. So the assumption is we just go to the private sector. There's almost no public sector ethos left. And that accounts for, I mentioned before, on Drumbray Care Home in 2016, when that was given care, 2018, I think, when it was given care inspectorate grades of 1, it's absolutely atrocious, right? Basically, the IJB did nothing for over a year, right, until it was issued with an improvement notice. Now, when I was a manager in Glasgow, if the care inspectorate gave us any grade, right, that was below average, right, we immediately had an inquiry, right? But somehow that has just disappeared from the, people are so obsessed with money, they've got no values left. And that's probably said it's not the fault of staff, it's just it's the system. I think it's also just worth saying that there are huge external pressures on the IJB too. So it's not all their fault, right? I mean, the Scottish government has totally failed to progress fair work in social care. So it's left the workforce. IJBs can't solve most of the workforce issues, right? It depends on the Scottish government doing it, and they haven't acted. The Lothian Health Board puts really unhelpful pressure on the IJB. I've just been reading today the latest papers, and it's saying they've agreed to keep Drumbray Care Home open, but only if another 30 or 40 beds were axed, which was going to make the situation worse. And you just think, hang on, the health board's just acting like a big bully here, right? But of course, the IJB gets a lot of its money from the health board, so they're stuck. Then there's the Scottish government as interference in how IJBs work. Was this thing called the Edinburgh Assistance Programme, right? And I'll just give, I mean, their report, which was leaked and the unions put out, it's just horrific reading. But just to give one example, right, they want the remaining local officers to be scrapped for a functional model of management. That will mean that it's even harder for anyone to see anybody, basically, right? They should be going exactly the opposite way. Then we've got the Care Inspectorate, right, which is absolutely useless, right? You might have seen in the press their recent report on adult protection, right? It focuses entirely on process, not outcomes. So it's all about whether the right records were on files, right? It notes there were 2 serious case reviews. That's where things go seriously wrong. Well, given the number of people who've been dying on the streets in Edinburgh and elsewhere, if you look at the deaths in social care, it's absolutely phenomenal, right? And the people who are dying from addiction, homelessness, suicide, and so on, just to look at the most, right? There's dozens of cases in Edinburgh. Only 2 merit a serious case review, right? Probably the rest weren't known to social care, but they're fundamentally caring issues. And then you have other people like Audit Scotland did a best value assurance report on Edinburgh in 2020, which basically says to the council, yes, you're in crisis, but you need to keep doing more with less. So it's a pretty gloomy picture, right? It's Carmen, I'm just going to have 2 more minutes. I've gone over my time, so.
I'm gonna leave you speak for another 2 minutes, and then I'm gonna ask you to wrap. Thank you.
I just say the IJB, I think it's not all bad, right? And there are a whole lot of contradictions in the system. And I think it's worth, from a campaigning perspective, it's worth noting some of those contradictions, right? So, I mean, for example, the IJB, right, they're saying we've got far too few home care staff, right? But then they won't increase the mileage allowances. So those home care staff were able to see fewer and fewer people, right? The mileage allowances are tiny amounts of money. So there are things that they're so caught up in budget lines. They've got no flexibility to do even small creative things, but that creates a space. They're promoting something called the 3 conversations model, which is what I would say is traditional social work and care. It's where people talk and listen to each other. Yes, we absolutely need it. But at the same time, they're doing social care direct. So you have to phone, disappear into this anonymous system rather than being able to see people. And they're setting up command centres. They've got command centres and so on, telling home carers what to do. So instead of home carers being able to have a relationship with someone, which is all important to the older person to know who's coming round, the home carer might be sent to somewhere else because the priority from management point of view is to get someone out of hospital quick. Right. So we've got all these sort of contradictions between on the one hand, they're saying things should be happening at the front line. We should all be talking and so on. And then they've got this increased centralization. So what can be done? Right. You could use the pause in the NCS bill to articulate a different type of care service. Right. I think some of you're all already thinking about that. I think it's worth making a campaigning for what I would call real co-design of care, and to start pushing for that to happen locally, so that actually people get involved in redesigning services locally and doing it from the bottom up. This idea that co-design can be done by the Scottish government's completely wrong. It needs to happen at a local level for local services where people need it, right? I've said enough.
Thank you very much, Nick.